Hello, everyone, and welcome to your Benco webinar. I'm just going to give everyone just a chance to get on, and then we're going to get started. We have a full house tonight, so we are really excited. This is a hot topic, and so I'm going to kind of rush through these the openers so we can get moving. So number one, I want to say good afternoon again, and welcome to your Benco webinar, Gateway 2022, Crossing the Bridge into Dentistry. My name is Kay Huff, and I will be your Benco host for this afternoon. Before we get started, just a few housekeeping guidelines. Number one, please make sure that you registered in your legal name, the name that is on your license if you want to receive CEs. Very important. Number two is that each person that wants to receive CEs must be on their own computer. So if you're watching it with someone and you both want CEs, we can't see that. We actually need to see that you're logged in. So please make sure that you get on your own device. And then if you're watching it on your cell phone and you've actually clicked the link, you're good. However, if you're calling in, all we're going to see is your cell phone number. So in order to give you CEs, we need for you to send me your telephone number, your full legal name, and the title of tonight's course to practicecoaching@benco.com. Again, it's practicecoaching@benco.com. Don't panic. I will go over it again at the end of the webinar. So if you didn't get it, don't worry, I'll do it again. So also when at the end of the webinar, you will be receiving a survey when you receive your CE. Please make sure you fill that survey out and send it back to us. We really want to know your input. So and then one other thing, on the very bottom, you're going to see a Q&A button. That's the button that we want you to push to ask the panelists questions. So again, do not use the chat. Please use the Q&A button to ask any questions throughout the webinar. We have an amazing team on tonight, and they're going to do everything in their power to answer all those questions live. Well, with all that being said, I'm always super excited to bring on one of the managing directors of Benco Dental, Chuck Cohen.
Okay, thank you very much. Good to see everyone tonight. We do have a stellar panel and a great topic. Before we get into it, I do want to make one very exciting announcement, and that is starting this year in 2022, we have decided to partner with Glidewell, the laboratory, to help sponsor their webinars. They've had them about 3 out of 4 weeks out of every year, and they will continue to do that in 2022. So in addition to our webinars, you're going to see us as a participant involved in the Glidewell seminar, the Glidewell webinar series. So we're excited to partner with our friends over at Glidewell, and we're excited to bring you even more education on an ongoing basis. So tonight's topic is COVID testing in the dental office. We have a stellar panel headed by Paul Jackson. Paul has 42 years of dental experience, 23 years with Benco. His job today is principal researcher. He spends all of his time researching dental products, and he has become our in-house expert on all things COVID. So Paul is going to walk us through the ins and outs of COVID testing in the dental office, PCR tests, antigen tests, all the different kinds of tests there are. In addition, we have Lori Owens. Lori has 18 years experience focused primarily on the billing issues in dental practices. So she's going to be the one who talks to us about how to bill properly and get reimbursed correctly for testing that goes on in the dental office. So Lori will be here as well. First, we'll hear from Paul, but Lori and Paul are going to work together. And then backing those two folks up, we've got Wendy Miller, who's Benco's Director of Merchandising, and Chris Organic, Benco's product manager, who's been overseeing our COVID product line ever since COVID started, and more broadly, our asepsis product line. They're going to get involved if there are specific questions about the products that are available out there for testing. So these 4 real experts are going to walk us through one of the most interesting and exciting topics in the country today, as well as in dental practices, and that's COVID testing in the dental office. Paul Jackson, you're up. Welcome, everybody. Thank you for being here.
Thank you, Chuck. I appreciate that. So good evening and good afternoon, depending on where you are in our great country, and a belated happy 2022 from all the Benco associates. And thank you for taking the time to participate in this webinar. The goal of this webinar is not to be political or to make public health determination. The purpose of this webinar is to focus on relevant information related to COVID testing and to share resources for you to decide how COVID testing might be incorporated into your practice. References will be available by contacting the site administrator at the end. Lori Owens is co-hosting, as Chuck already said, this webinar. And our goal is to complete the informational session in 40 minutes. So there's going to be time for you to, ask questions and for us to give you feedback. So the world's changed a lot these 2 years, but the human race, does have more knowledge and resources to address COVID in 2022. But the virus is changing too, evidence Omicron. Only 47 days ago, we were notified of its presence. And just think back in your mindset 50 days ago and how different your family and your practice were. As Dr. Murthy, the Surgeon General, stated back in August, this is endemic. And this might sound obvious now, but pandemic, endemic is controversial. And I ask you, do we need to change our actions and thinking to how do we live with COVID rather than how do we beat COVID? 2 items of information for your consideration for proof of endemic disease are a Danish study that shows that even boosted patients are being infected with only 45% protected against Omicron. And this is similar to a flu vaccine. Number 2 is Sir Andrew Pollard, head of the UK's Committee on Vaccination and Immunization, said it best. We can't vaccinate the planet every 4 or 6 months. It's not sustainable or affordable. Pfizer announced that they will offer an Omicron-specific vaccination in March, when many feel that the peak will be over in February. So how are we going to live with COVID? And so testing is a tool, and you can see in this picture, this was in Times Square, but testing is also going to be a challenge. So let's learn about COVID testing. And so there are 3 different types of testing for COVID. So the molecular, and you notice the PCR test, antibody, and the antigen. And so the molecular, we're very familiar with it. It takes 1 to 3 days in a high complexity or medium complexity lab. There are now 3 tests for CLIA waived labs, but they're expensive for the instrument, and the tests themselves are expensive, over $50, and they take almost an hour to process. And so antibody is not appropriate for this, for practices, but antigen, they're 10 to 15 minutes. We're all pretty familiar, and it detects the proteins, the antigens. And so that's how it's able to see, detect the virus. And so this slide is really a very interesting slide. It's a JAMA slide, and it's actually been available for a while, almost since the beginning of COVID. They did the research on it, and this slide might collapse in timeline or expand, based on the patient and based on the virus. And so Omicron, it's a lot shorter, with the time of infection, but still, it helps you. It's really good, to explain, why testing might not seem like it's working when it actually is measuring accurately. And so this red line is when you are contagious or infectious. And so it's a really important line. And so, like I said, maybe with Omicron, it might be a little, faster, but still nonetheless, there's a time where you're infectious. And again, you have an exposure. You might not have symptoms yet, but you still are infectious. And so with this goes the blue line. And so this would be the PCR tests. And when it can detect enough of the virus, that it can identify a patient who is infected. And the antigen line would be very similar. The only place that would be different would be a little bit shorter line here, after infection. And really that would be a benefit. And antigen tests are very good, for that. And so that's why we've moved to those. But the key here is detection unlikely. And so if you look, there's actually a new school procedure that's being expanded. And so if a child has an exposure, they used to send them home and for 2 weeks, and so that they could, possibly not be infected. And so they've changed that protocol now. And so they ask them to put a mask on and they test them. And so, it's possible that they would be in this area. And then but they test them 2 or 3 days later. And so you can see that then, when they are infected, that it would show with either the antigen or the PCR test. So this is a lot more appropriate. And it's why, when you test, you're going to need to test often. And so that it's important, if you're going to test often, that the cost of the test needs to be low and the results need to be quick. And so this is going to be, there's a QR code there. And so you can scan that. And so this will be a really important tool for you, because when you look for antigen tests, and we know and hear about how the government is buying, 500 million tests, that's going to really make the supply difficult. And so going to this site, you can see all of the approved FDA tests. And not only can you see them, but they also give all their specifications. And so you can see how accurate they are, or if they're appropriate for your office. And so it'll be really important. And there's a lot of not good tests out there. And so as the FDA, removes tests, they'll take them out of here, or they'll add tests. And they have been adding tests, trying to help the nation do more testing. And so as of today, I looked this morning and there's 43 tests there. And so, but again, they add them as soon as they're approved. And so when you go to the site, it'll go, it'll explain that, is it a high complexity, a medium complexity, or a CLIA wave test, or an OTC, home test. And so when you look at that, you'll click on the IFU, the instruction for use. And when you go through the instruction for use, it'll explain all of how it's used and the procedure, but it'll also have, how the results of their testing and the results of the accuracy of the test. And so really important is sensitivity. And so sensitivity identifies who's has COVID. And so, and I would offer that really any test, and there are tests out there, any test under 90%, that means it's going to miss 10% of the patients. And you already remember, from the chart that you're going to need the best level of detection that you can find. And so, there are tests out there in the 80s. And so it's really important for sensitivity. Specificity is false positives. And so, so like if you test a staff member and it says they have COVID when they really don't, you'll be sending them home, asking them to, take time off when they really don't have COVID. Fortunately, the antigen tests are all mostly 100%. So they're very accurate on, the patient. If it says they have COVID, usually they do. And that's one of the benefits of the antigen tests. And so I picked 4 different companies to give you an idea, and 4 different tests, so that you can see, what information would be, in the FDA site, among other things. But, so this is a very popular test, the Binax Now, and so, but has low sensitivity. And so, but the specificity is high. It is a lower nasal test. And so, you will look in that IFU that, some of them are nasopharyngeal. So that's going to be difficult. And you could say, well, difficult, so what? Well, you want the best opportunity for a good outcome. And so if the patient, pulls back, or your staff is resistant to, taking a nasopharyngeal, lower nasal is going to be a lot easier and more accurate. And so, but you're going to see OTC, and then the selling price, and then what the net price per test is. And, the last part on this slide is, it's really interesting. So here's the Quidel Quick View, same test, But how do you have different numbers? Well, that's because this one is an OTC, so home use. And so when they test, they have a non-trained user take the test. And so the results are often lower. And so that's why the difference, but both tests are actually the same. And then there is instrument read. And so you're always going to find, generally speaking, that the instrument read will be higher because there are very slight differences in the lateral flow tests that are hard sometimes to read visually. And so this is pretty much how all the lateral flow tests work, is that you take a sample, you put the reagent in a tube, you put the sample in the test tube, you mix it and for a period of time, and then you put it in usually 3 drops in the lateral flow test. It moves up the test, and then you read the lines. And so this would be a typical illustration of a read. And so, you could look at that and say, oh, well, the patient definitely has, COVID, but you have lighter lines, and then lines like this is where instrument read is actually better, at reading. And then, so this would just be a negative test and the control line shows. So, in summation of the testing, you're going to have to decide, as the healthcare provider, if and how you will use COVID testing in your office. And so when you have, really less than 30% are asymptomatic, and it could be as high, especially with Omicron. And so, are you going to use it to market to your patients? If they're afraid to come into the office, you could show them that you're very, all the staff has been tested. This is a safe environment. We all mask and glove. And so, there's different ways that you can use testing for your practice. And with that, I will ask Lori to explain about CLIA and billing, if you would please, Lori.
Okay, so I have worked mainly in medical billing for dentistry throughout COVID, just so you know. We truly do recommend it. And it is something that Paul hit on before, CLIA waived. CLIA waived, what that means is you are not declaring your practice as a full-blown lab, that you're stating you are going to do specific testing for specific things, whether it be HbA1c or whether COVID. So those are 2 of the CLIA waived tests, but they are for professionals. And that's where Paul showed you the difference in the over-the-counter versus the CLIA waived sensitivity. It's higher for a professional because of what we do. So just so you know, that's kind of important because it gives you the ability to bill medical and provides a service for your patients and staff. So you need to set your protocols. Who are you going to test? Who within your practice wants to test? We think about that one person that says, well, I want another job. Hey, you want to be our COVID tester? You never know what that could do, truly. But those people are going to take it to the nth degree and do it really well. What about, are you going to bill medical? Are you going to, I can tell you dental insurance is not going to pay, but we've seen some great things on the medical side. It does, it's all encompassing for full service dentistry. And then how much are you going to charge? That's important. We're not in dentistry to give things away. I hope you're not. We're in dentistry to provide a service and to be able to pay for things and be able to get other things. So what about the results? The great thing about CLIA is when you get your CLIA waiver, they show you your reporting system on how to report it. So it's not something that you have to create all by yourself. You're going to be instructed on how to do it. Could you advance for me, Paul? Now, the protocol, complete the test. I know that seems silly, but it's true. You have to be able to go with those manufactured instructions, and whoever in your practice is going to be doing the testing, make sure they follow it. It's kind of like COVID testing for dummies. And I say that kind of funny, but it's really very difficult to do it wrong. How about this? 10 circles in the right nostril, 10 circles in the left. Oh, you only did 3. Okay, well, we'll just run it anyway. What does the instruction say? 10 and 10. So following the testing guidelines is important. And that's when it comes to CLIA waiver, that is very important to do because they're trusting your practice to do things the way the manufacturers suggested. So again, please just remember testing. What's your protocol? How about your waiting room? Are you testing in your waiting room or is it going to be in an operatory? Is it going to be in their car? If you have a small waiting room and you're going to be seeing patients, that might not be the ideal place to do testing. But what about your operatories? Well, you're running patients in and out of those, but maybe it's the car. So create that protocol, whatever it is. Your patients will appreciate you protecting them as well as your staff. And it's really, to me, a win-win. So your negative or your positive results, once you have a CLIA waiver, will need to be reported. And again, like I said, they will instruct you on how to do it as well as your tracking system. Can you advance, please? You have to advance, Paul. I can't do it.
Sorry.
Now, who are you going to test? So this is where a lot of practices say, well, I'm just going to test everybody. Well, that's not feasible. It's really not feasible. If you have Mrs. Bell, who's been in her house and she hasn't gone out and she has her groceries delivered and she's 50 years old and there's really no health concerns or constraints and she hasn't been around anybody. So again, what are you going to do for who you're going to test? If somebody has, okay, if you're like me, I travel a lot. You're probably going to want to test me to make sure I'm not sick or getting other people sick. I have a doctor right now in New York that he does flight testing for his dental patients so that they can go on a flight with his testing. So I hope that makes sense. They provide him the documentation that they can show that they've had a COVID antigen test and they're able to travel to other states because of what this doctor does. So, and I'm saying it's not necessarily going to be everybody in your practice to be testing, but you as the provider, what would you want that protocol to be? Can you advance, please? And then who? Again, I sound like a dying horse, but who's going to do it? Read the instructions. As the clinician, you need to make sure they're doing it properly. The doctor does not have to do the test. I hope that people understand that. This is not that the dentist needs to perform the test. Somebody on your team can perform the test, but it's the doctor's responsibility to make sure it's being done correctly. So who's going to do it is important. How they're going to do it, the doctor needs to follow up on training. So let's forward. Tracking and reporting. CLIA does help you. For completing a CLIA waiver, when you complete your CLIA waiver, you will get a CLIA number that provides for you submitting to medical, as well as providing them the provider that completed the test. So like for the doctor I told you about, he's doing it for his patients that need travel documentation. They complete, he has to put his CLIA number as the provider that completed the service. So it's important, but CLIA gives you all of this. Right now, CLIA in each state, because each state is who gets your application and they provide you that CLIA number. It's about 2 to 3 days. I've had Michigan doctors get their CLIA certificate in 24 hours, but I'm not gonna tell you it's gonna only take you 24 hours. 2 to 3 days has been the average, where it's been 4 to 6 weeks. Why? They're looking for dentists to step up. They need you to step up to help. You're going to stop an overflow in the hospitals. There's so many things that you can do to help your patients? And how much better are your patients knowing that you're looking out for their health? That's huge. So when it comes to tracking and reporting, it's clearly documenting your positive results and your negative results. And again, they're going to give you a portal that you're going to be able to do it on. So it's not so much time from your staff to complete. Can you forward? So getting started, the CLIA waiver, there's actually a PDF fillable CLIA waiver form that you can get. And all you need to do is go to your state. Here's a good Google. Google CLIA waived application for Washington State. It will give you the PDF to fill out. It's about $180 to $200 for a 2-year license. And you can put the specific tests that you want to run. It is not huge. It is not a long process. Once you pay your money, you will fax your CLIA application over to your state, and you're going to get a response in a couple of days. So again, once you get that, then you're going to order your supplies, because when they give you your certificate, they're going to give you your CLIA waive number. That's what you'll need to order supplies. So it shows what tests you're doing and who the provider is that's doing it. And then, of course, I'm going to go back to set your protocols. How much are you going to charge? Are you going to have a cash price? Are you going to have a billing price? Either way is fine, but it can't be different for people in your practice. You can't say to one person, I'll charge you $25 and somebody else, I'm going to charge you $75. It has to be the same. Your fee is your fee is your fee. Just because you're billing medical does not mean that you can jack up your fee. Your fee is your fee is your fee. Don't waver on that and stand by it. So when you set your fee, make sure it's appropriate to cover your costs, as well as to make sure you're able to get more testing. So let's move forward. Now, the CLIA waiver, how it works in POC as the point of contact, that's when your patients are coming into you. And it's the CLIA waive means that you are not running blood samples and stool samples and all those things, that these are only tests that have been approved as CLIA waived. Like Paul said, when you pull up that QR code, it's going to tell you it's either OTC or it's CLIA waived. If it's not CLIA waived, that means it has to be completed in a lab. You cannot run that test. So always look for the CLIA waived testing. And again, CLIA has it's the clinical laboratory improvement amendments. They're looking to make sure everybody's doing it the same way, the right way for accuracy. Let's move on. So the waiver process is you get onto your state, you get your application. There are laws, because there might be, I'll give you, for instance, in Washington State, to do CLIA, you have to pass a bloodborne pathogen. It's free. They offer it on the state of Washington website, and you'll get your certificate that you passed it right away. So whoever does your CLIA waived in Washington State just needs that the bloodborne pathogen that they passed that class, which is it's a very informative but also not difficult. So check your state requirements for whoever's completing that test to make sure that you're in compliance. Complete, it's called a CMS 116 form. Again, it's PDF fillable. So you're not going to have to write it out. You can fill it right on your computer. There's a website on here so you can find your agency of where to send it. So if you're ever not sure, it has an agency of where to send it, as well as where to pay your money to. So each state might be different in how much they charge, but it's about 180 to 200, and it is valid for 2 years. So if you think of it this way, at the high end, if it's 200, it costs you $100 a year to be able to help your patients know. And I'm gonna go out on a limb, Paul, to say this, but this is not going away. It's not going away. This is going to be continuing for years and years. And so for us to stick our head in the sand and say, oh, well, I can't, I think those 3 monkeys, I can't hear you, I can't see you, and I'm not going to say a word. It's here. So let's deal with it to help our patients the best way that we can. Let's move on. So documentation, when it comes to what you're recording for in your chart notes, patients show symptoms of COVID and COVID-19 testing is medically necessary. If the patient has symptoms, don't you think it's medically necessary? Now, could it be a cold? Yes. Could it be the flu? Yes. It could be so many other things, right? It could be ear infection. It could be strep throat. It could be so many other things. But we want to make sure, because COVID is so prevalent, we want to rule it out. So the test, and you labeled whatever test it was, the quick view. Test quick view was completed and the results were negative. So you're doing your due diligence by completing your chart note. Patient has no symptoms, but has known or suspected exposure, like somebody in their family, they think they have COVID. Now, it doesn't mean that they have to have confirmed COVID, okay? It could be that you have crazy Aunt Sue and she's always coughing on everybody. Okay, you could just say, yeah, I have crazy Aunt Sue and she coughs on everybody. But, and they might say she might have it, could be, but she's not been tested. So it doesn't mean that they have to have a confirmed test. So I hope that's clear. And test, and you could say quick view, you could say whichever test you're utilizing was completed and the results were blank. It's a very simple. If you want this, I will give this to you for your documentation. It's not, I promise you, you can change it and edit it however you want. It is recommended that the patient be tested for COVID, but patient decline. So remember, if you think that the patient has something and you've recommended that they get tested and they decline, you need to show that, because otherwise, again, if it's not in the note, it didn't happen. Patient has significant symptoms of the COVID virus. Patient is being referred to their physician. Can you outright say, I cannot treat you, you won't let me test? You better do that, because you're exposing not only you, your other team members, and your entire patient base. And that's not right. You need to put your foot down and say, I am afraid I will do you more harm than good. I need you to go see your physician, and making this note in their chart. There's nothing wrong with that. So let's go on. How to get paid for COVID testing. This is what I like. This is kind of my jam. So you can say cash. You can be a cash office, but remember, if you're only going to do cash, you need to only do cash. That means you can't say, all right, I'll just do it for you, because then you're not offering the same to everybody. If you offer them cash or medical insurance and you offer that to everybody, that's fine. But you can't just pick and choose who you want to offer it to. Either offer whatever or all of it at the same time, or it's either going to be one or the other. So you can't vacillate between multiple ways of doing it. So if you're going to say, okay, if you want to choose our cash fee, this is what it is. If you'd like us to bill your insurance, this is what the fee is. Either way, you have to decide what that looks like. Let's move on. So dental billing options, there are codes, but just so you know, MetLife has said they're not going to pay for it. Delta Dental has said they're not going to pay for it. Now they did pay. I don't think they're any longer paying for additional PPE, whereas medical created their own code for PPE, additional PPE. And we have seen additional PPE get paid, because you as a dental provider have to get additional PPE. I think you should be paid for it. Now, what that looks like, again, you got to figure it out. So 604 is for your antigen. 605, I'm not sure why it exists, but it's an antibody test. That means you already had it. So it really doesn't make sense. Not only CDT created the code, but medical created it as well. But just know that even though there are codes, does not mean it gets paid on dentistry. Let's go on to the next slide. So I love that Paul, that this is an endemic, and I meant to change this slide and forgot. It is an endemic. So we have to remember it's going to be here. It's not going away. Pandemic is a period of time. Endemic is I don't think it ends. Do you, Paul? I don't think it ends. But even though we're in this endemic, Medicare, Medicare Advantage, and Medicaid, you have to be enrolled providers. So if you're an opt-out provider with Medicare, you can't bill your COVID test. Even if you have your CLIA waiver, you have to be a Medicare provider. Now, believe it or not, they're moving fast on Medicare applications. And if you'd asked me 5 years ago, I'd have told you not to be a Medicare provider, and I've changed my mind on that. They are actually moving forward with benefits for dentistry very quickly and very handsomely, I should say. The Medicare Advantage, if you are not a Medicare provider, Medicare Advantage, even on the dental insurance, is going to stop you from billing. So please be careful and be aware of that. Medicaid, you must be a Medicaid medical provider, not dental provider. So on the medical side, you need to enhance your registration with Medicaid if you are a Medicaid provider, and ask to be a Medicaid medical provider. So I hope that covers that. So even though we're in this endemic, doesn't mean that you can automatically bill. You still have to be a registered provider. Let's go forward. So when it comes to medical billing for COVID testing, there is only one procedure code that the antigen test would cover, which is the 87426. Diagnosis code, that's going to be a little different. So the procedure code, or in reference to our CDT code, the CPT code, the 87426, would be diagnosis wise, ICD-10. There's a few things you need to know. So if they've been in contact with someone that they're suspecting had COVID, not confirmed, but they suspected, we would use the Z2828. Now, if you did the test because they were exposed to something else and you're ruling it out, remember, like I said, it could be a cold, it could be a this, it could be that, but you want to rule it out. You can use Z03.818. How about if you're screening for other viral diseases, Z1159. Now, if they are positive, every positive, you cannot use anything but B34.2. That has to be your code. So if you have a positive COVID test, you must use B34.2. I don't know if you knew this, Paul, but everything in the infectious realm always starts with the B in medical. Pretty cool. Let's move on. So if you want to add symptoms, if your patient has told you that they have a cough, they have difficulty breathing, all the R codes that you see here are symptoms. These are not, doesn't mean that just because they have it, they're positive. It means that the patient has stated that, hey, yeah, I've had a lot of nasal congestion, or I have nausea. Well, it could just be my husband's cooking, but still, or vomiting. Yeah, my husband cooks really bad, but beyond that, the symptom, you notice there's a nausea with vomiting. Maybe that's the husband's code. I don't know. But you have lots of codes for symptom-based things. That's why you would want to test. Let's go on. I wanted to show you some doctors that we work with that are actually billing for COVID tests. And I wanted to give you, I brought 5 because I want you to see Empire Blue Cross. This doctor billed out $179 for his COVID test. And you can't see it real well, but the code is on there, Paul. And then Empire allowed 120 and they paid to the provider 120. Let's go to the next one. Now this next one, you'll notice this doctor only billed out $78 because he decided his fee is $78. Highmark Blue Shield, they allowed $41.82. I'm sorry, they didn't allow. They allowed $41.82. They paid $41.82 with the patient portion of $36.18. Let's go to the next one. I tried to get different insurances. So Cigna, this doctor billed $78, and notice they paid in full $78. So one thing you should know is that they do not apply the COVID test to the deductibles. If it was if we weren't in an endemic, they probably would, but because of the endemic, they're not applying it to deductibles. Let's go to the next one. This one, I can't remember the insurance company. I think this is Aetna. Pretty sure it's Aetna. $78 is what they allowed, or yeah, they allowed the whole 78. The patient was responsible for $46.97, leaving the provider at $31.03. So you can see that doctors have different fees, but not just that, the insurance has different patient portions. Sometimes it's in full, sometimes it's a portion. So I don't want you to think that, oh, hey, I'm going to start COVID testing and I'm going to get my full fee every time. That is not true. So you need to make sure whatever the fee is, that you're okay with that. I think, do I have one more, Paul? Last one is Blue Cross of Tennessee, again, 78, and they paid the full fee at 78. So I just want you to see that different insurances have different policies under different providers that give you the allowed amounts and everything else. Hey, Paul, I kept it at 22 minutes. I just want you to know that.
Thank you, Lori. Great job.
So we have questions. First of all, I want to say this. If you have raised your hand, if you'll type your question in the Q&A, I don't do the raise hand thing. So type your question in the Q&A and we will get to them. Yeah, I have a real question though. Is there an advantage to an office being CLIA waived, Paul? I mean, is there an advantage to that?
Well, you're a laboratory, and so it really gives you the permission to charge, the patient or the insurance company. And so as a laboratory, that's really important. And I think too that, it allows you also to report so that, because a lot of these, over-the-counter tests are going to be done and we're not going to have any idea of the results, either, positive or negative. And so you'll be a part of the healthcare community also reporting, the results of those tests into the population.
Fantastic. And then the other question, Paul, is, when you go to that website that you talked about, is that how you get the CLIA waiver and the number and the certificate? They're asking, like, how do you get it?
I had a website on there, and I'll send it to you, or Paul can. It's on the slide. It's a website where you can go for your state requirements and the CLIA waiver certificate application.
Fantastic. So, all right, Dave, we'll actually send that to everyone so that everyone will have it and be able to go to it. And then our good friend Leslie asked us a question, Laurie. She wants to know, basically, she says not all states, and I guess she put California in parentheses, are allowing team members, because they're not nurses, so to be able to do the COVID test. So again,
I will tell you, go a little further. What they're saying is they can administer it, they can't read it.
Okay, very interesting, Leslie, because meeting the board.
In other words, I can give it to them, they can do it, I can put it in there, but the doctor is the only one that can read it.
Okay.
And it's the same way with the HbA1c. You can see it, but you can't read it.
Okay, so Leslie, I hope that answered your question, because she was really concerned that that the dental board doesn't allow as a scope of a practice for a team member. That's what she had said next. But you're saying that they can't.
I'm saying under the CLIA waiver. So you're talking dentistry, we're talking medical CLIA waiver.
Great.
So different.
Hopefully that answered her question. And then Chris, I know you kind of answered this. Maybe you want to answer it out loud. For DSOs, do you have to get a CLIA waiver for each location? And is there an additional cost for each of those locations? Chris, you want to answer that?
Yes, I would check with your local state agency on that. I've had that question asked multiple times, and that's the answer I give, only because I don't want to say something that's incorrect, because it does, I believe, go state by state.
Okay, good one. And then I don't know, either Paul or Laurie, if you're doing the testing and there's a positive result, what is the protocol for quarantine and exposure of employees? Some employees are very happy to quarantine themselves than others. So who wants to answer that one? So if you're doing the testing and let's say one of your employees test positive, which, who wants to answer that one?
I'm gonna let Paul take it and then I'll say
No, I'm
something.
gonna let Lori take that.
So I do have a protocol. That's part of what I'm sending you as to what to do if a staff member, and then also I have a follow-up email that you want to send to your patient. Does that make, so there's a protocol. So each state is, right now it's a 10-day. It's a 10-day from any symptoms or 10 days from the positive result.
So, and even if their team members are vaccinated, they still have to quarantine as long as they're not wearing their masks. As long as they're wearing their masks, they're probably going to be fine, correct?
Paul?
I-
Because
You're gonna go with the protocol.
it's iffy in state by state.
So it has to
Because,
check with their state
yeah,
board.
I mean, state by state, they can say you can't step foot in there for 10 days. And other ones can say it's 5. So definitely find out how many days you are required to stay home from the positive COVID test. I mean, it has varied even in Washington state by county. So King County, it's still 10 days. Snohomish County, it's 5.
So the next question is that I guess some insurance companies, according to, this is Sheila, some insurance companies are saying that they'll do 6 to 8 tests as kind of like the limit. And if they reimburse less of the cost, in many situations, the offices aren't buying large quantities for the test for the better price. Do you know anything about how many they're allowed to take a medical?
I have, so it's funny. So when I was pulling those EOBs for you, I saw this one doctor in New York that he has a guy that flies a lot. And I swear in one screen, I saw 10 COVID tests for the same person and all paid. So I mean, I would be surprised. I mean, he has to have the COVID test in order to fly. So I found it very funny when I kept seeing, it was that's the exact same guy. And he tested 10 times on different dates. And so, I mean, I have not seen any limitation to how many tests. And it's gonna go by that diagnosis code that I told you, if they need it done to rule out the fact that they have COVID. Does that make sense?
Yeah.
Okay.
So Wendy, this is probably going to be for you. They want to know, what do you foresee as the availability for the COVID testing, for the COVID test?
So I wish I had a crystal ball, but so as you all know, right now the availability has been tight. I think Paul or maybe Laurie mentioned earlier, the government has taken hundreds of millions of these tests. And so it's consumed a lot of the capacity of the manufacturers. Our belief, based on what we're seeing right now in our company, is that it's going to probably be end January into early mid-February till there'll be a better supply of the tests in the dental space for what we're distributing. And most likely, and again, this is not definite, but most likely we're seeing that there may actually be a higher availability of the CLIA wave test because everyone and anyone can buy an over-the-counter test and use it. So there may actually be more of the CLIA wave tests available.
Thank you. So I wish you had that crystal ball, Wendy. I really do.
Yeah, me too.
Okay. And then let's see, why would a patient agree to a COVID test at our office if an OTC is $14 to $20 over the
I
counter?
haven't seen that. I've seen them at free.
No, they are that cheap.
Are they?
And so, yeah, and I think that's at least that's the limit that the government is putting on them. I mean, it's just a different test, and I guess the insurance company has to pay for it either way. Yeah.
But Paul, did I not hear you say, and I'm asking too, that certain tests are better, higher quality than others? And did you, so really
That's correct.
There's going to be a different level of positive,
Accuracy.
negative, right?
Right, it's better accuracy. Also too, the tests that are the CLIA wave tests are going to be, less than $6. I shouldn't say less than $6. They're going to be under $8. And so 6 something for the ones that we showed there. But they are more accurate, and you're going to be billing the insurance company. And I think really what the Biden administration was trying to do is make sure that the patients weren't paying, whether that was a over-the-counter test or whether it's a test that's done in a dental office or any other laboratory.
Paul, I just want to repeat just to make sure they understood your answer to their question. So as a patient, I could go to my dentist, and there are many people that might feel more comfortable having someone in the medical field do the test. They feel like they're going to get a better result. And now it hasn't cost me anything, not even $14, because my dentist has done it and they're billing my insurance company, as opposed to me going and buying one and spending, somewhere between $12 and $14 for a test. I just want to circle back.
And thank you for clarifying that. And that's even if you can find a test.
Right.
But again, we're trying to project out into time.
Well, and plus so I'll give you for instance, when I was in Hawaii, I have one daughter that couldn't get her vaccination because she had COVID and she had the antibody therapy, and you can't get your vaccination for 90 days afterwards, but she had to have a COVID test every 3 days. So what was she going to do? If you get an over-the-counter test, you have no proof. Does that make sense? Whereas
Taking the test.
the dentist can actually write a certificate of when your test was negative. Does that make sense? I hope.
Yeah, it does. It really does. Thank you. Thank you very much. And thanks, Wendy, for helping clear that up. I really appreciate that. And then Laura, do they have to pay? Let's see. Do you have to pay for medical billing software in order to be able to bill this?
Nope. I mean, you can download a claim form. You can get on their portals. I mean, it really is up to you. We have a medical billing software, but we're talking about dentists that are doing probably 15 to 20 tests a day. So, they have the volume that goes beyond the periodic 1 to 2 tests a month. So it's really going to depend on, what are you doing? How many do you want to do? Do you want to do all the legwork to follow up on those claims? Because we do the follow up for you. So
Yeah,
really your team files the claim and we check on it and make sure it gets paid. So it's a matter of staffing wise, I should say.
The next question is, Paul, this is probably gonna be for you. How does the PCR test differ from the antigen test?
Yeah, so it's looking for the actual virus. And so that it's a different test. It has to be done in a lab. They take the sample and then it has to be cycled to get enough of the virus replicated so that then they can find it. And so, but it's looking actually for the virus, the RNA in the virus. Whereas in the case of the antigen test, the evidence is looking for its protein. And so it's not actually looking at the virus, it's looking for the protein that the virus has. And so it's a little bit different, but it just takes longer for the cycle times for the PCR tests. And so I don't know if that answers the question.
Yeah, I think that did.
It's more accurate. The PCR tests are definitely more accurate because it actually is seeing the virus. And
Got
so,
But it touches the brain.
So if we are testing our employees only, do we need to have a CLIA waiver? Who wants to take that?
I could actually. Oh,
Okay,
go ahead,
Chris,
Laura.
ahead.
I just meant to purchase the test. You do need to have it.
Yes, exactly. That's exactly what I was going to say. If you purchase this test, you need to have the CLIA waiver.
And just because you have the CLIA waiver doesn't mean you have to submit to medical. So,
So no, the question was if
just
you're-
so that it's
I wanna
okay.
clarify. Wait, let me clarify. So Chris, if they're testing employees only, they're asking if they're testing employees only, do we need the CLIA waiver? So what was the answer? I want to make sure.
They have to have the CLIA waiver in order to purchase the test.
Got it. The test that the CLIA. Okay, good. I want to make sure I was okay. And then can a dental office provide PCR testing with their CLIA waivers? Paul?
Yeah, they would have to buy a PCR test. And so they're just recently, there have been PCR tests, but that are available for point of care offices. But the instrument is very expensive. It's a very complex process. And then also it takes about an hour for the cycle time, and the tests are not inexpensive. They're $40 to $50 per test. And so I don't think it's appropriate, but I am not the healthcare provider, so I can't say what level of accuracy you need in your practice. But if you go through the tests and get an instrument version of the antigen test, like the Clip Health one, it's going to be almost as accurate as a PCR test. And it's going to be done in 10 to 15 minutes with high accuracy and much lower cost. And the point too is you really, one of the things that's important is you only get a snapshot of time. And a PCR test is, again, if you get in the point of care office ones, it's possible, but you're going to need to be testing probably at least twice a week. Again, that I don't set the protocol, but if you really want to catch this in asymptomatic or pre-symptomatic patients or staff, then it's going to be really important to test often.
Got it. And again, I want to say, if you have your hand up, if you want to just like make sure you put it in the Q&A, I can make sure I read your questions out loud. And then let's see, someone asked me, will there be a recording of this webinar available? Yes, there will be a recording available on our Benco U. So just let me know and we'll make sure that you can go on and get that recording to watch with your team if you'd like. And then, are dentists charging their team members?
I have not seen dentists charging their team members at all.
So again, I think that would be, if I have a team member that's gone on vacation, not sure, maybe they want a protocol, maybe they want to test. It really, I think it's a protection of the patients. So I kind of agree with you, Laurie. I don't think that should be something that should be done. Do team members need special PPE to do the test?
Not that I've seen.
Wendy?
Have you seen it, Paul? I haven't seen any
No,
additional.
And I even want to go back to the one question, because I was looking through the Q&A and someone asked if there's a positive, I think maybe the question was too, is that if you're doing the testing and then, now we have the antigen test and the patient is positive, does not only the patient need to leave and the staff member because they were quote unquote exposed? I think with proper PPE, they're not sending every nurse that's in a hospital home that's done testing. And I think you're going to have a similar, PPE, because you really don't know. I don't think most dental offices are going to test every patient that comes in the door. And so you are going to be exposed to patients that have COVID. And so, and other sickness, the flu. And so your PPE needs to have the integrity to protect you. And so I think that's, anything else, Lori?
No, I think you got it right. I think that now I would recommend.
She froze.
Uh-oh.
That's
Yeah.
okay.
I think what she might have been trying to say was I would recommend masks and gloves when performing the test.
And goes without saying, really, and I'm sure everyone attending this call, the dental practitioners know, N95 is the first mask that's recommended, first line of protection. And of course, exam grade gloves, and, protective clothing. And you're wearing those types of PPE anyway, as you're seeing all the patients. So it's really no different than what's being recommended to wear when you're doing your normal treatments of patients.
Yeah, that's a great answer. That was fantastic, Wendy. We're already doing all those things to make sure we're taking care of everybody. So just continue to do what you're doing. You can add that testing on as long as you're following the right rules. You're in really good shape. So then they said, what if a patient tests positive? So Paul, I think you just answered that.
Laurie too, in the protocol, Laurie.
Yeah, the protocol, they have to go see their medical doctor. You give them the slip that this is the test we did, this is the date, this is the time, this is the result.
And so, hey, Wendy, there's another one that says, if Benco's selling the tests and supplies, how do we learn about that and the cost, and the availability of that? Do you want to answer that one?
Sure. Talk to your friendly Benco territory rep, and they can give you all the information you need about anything that's been discussed on this webinar tonight.
Then another question, again, I guess the question is if we do not bill for COVID testing, is it necessary to have the CLIA waiver? And I think that we need to bring that home, because I think that's a super important message, right? Paula, do you want to take that one or
yeah.
I think Chris answered it, is that, it's part of the CLIA waiver, the FDA process, that these tests are tracked. Now, I will say we just got, we got a result back from the Pennsylvania state, and they said, who's supposed to track? We asked them who tracks it, and the Pennsylvania state, well, the user. And so it's a little bit vague, how they get tracked, but it is part of the FDA process that these tests are tracked. If they're a high complexity, a medium complexity, or CLIA waived, the FDA says that the manufacturer needs to track these. But there are some tests that we are not allowed to sell unless your CLIA number is in there. There's other tests that other people have that don't, there's no place to put the CLIA number. And so, but technically you are responsible for that. It's $200. And there will be other tests, that will be coming. It's really any quarter now, there'll be a test for oral cancer. You take a swab and you'll be able to detect oral cancer, precancerous. And so CLIA wave testing is a part of being, it's part of the healthcare system. And so it's really, there's going to be more CLIA wave type tests. And so it benefits you. The cost is lower under CLIA waived, and there are more opportunities. Laura, you were saying too, some practices are testing for diabetes.
Oh yeah, we tested HbA1c with professional kits for, and if you think about how many people have undiagnosed diabetes, and we charge $25 and medical usually pays 100%. It's just, our practice has found so many people with undiagnosed diabetes because the oral cavity is that direct connection to diabetics. And if they're not being treated, they're going to have a larger breakdown of the oral cavity. And I'm going to add upon what Paul was talking about. CLIA waiver, with all the new tests that come, you just add it to your current CLIA. You don't have to get a new application. You just add it to your current list of what tests you want to be running, and you have applied the same CLIA wave number.
So we have so many other questions. I know we're not going to be able to get to all these, but Chris, I'm hoping that you and Wendy will be able to help us out and answer all these questions. So if we didn't answer your question live, we will get to it. I want to answer a couple more while we're pulling up our ending slides. Number one is that, is the CLIA waiver fee a one-time fee or is it a yearly fee? Does anybody know on that answer?
Every 2 years.
So every 2 years they pay a certain fee. So that was that one. And then what about expiration date? Someone said they had gotten 250 tests in a box with a QR code on a scan on it. How do they find out whether or not those tests are expired? Is there supposed to be a test expiration date on them?
Most of the tests that I've seen do have expiration dates on them, and I'm ballparking this because different tests are different, but most of the tests that are coming out and being put onto the market have, I think, close to 2 years for, that they have a shelf life of 2 years. Paul, do you want to add to that? Because
we'll just check with the manufacturer, because some tests have a short dating because of the EUA.
Right.
And so check with the manufacturer. It's possible that those tests actually are valid longer than the expiration dates.
Well, the ones that are, those manufacturers actually have a separate document that often is shipped out with the test that indicates that. But the expiration is on the outside of the box or on the test most of the time. And if there is something different from what's on the box, there'll be a PDF or a form that comes with the test that shows that.
And so Wendy, the doctor's also asking, does she need to get a CLIA waiver to use them? She hasn't used any of them yet. She has 250 of them. Does she need to have a CLIA waiver to use them?
If you're buying the CLIA wave test and you're administering it to anyone, you need to have the CLIA waiver. That's Laura, you can add to that if you want.
I would not be doing them until I had mine.
So yeah, and then again, I'm getting the same question about Benco. Yes, Wendy, can you buy the test from Benco? Absolutely, what Wendy said. Check with your friendly Benco rep. If you don't have one, email us at Practice Coaching, and we'll definitely make sure we have get someone in touch with you. So Rachel, why don't you go ahead and pull up the ending slides for me? So I definitely want to say thank you. You guys were amazing. This was a fantastic panel. I know that we could probably keep going because there are so many more questions that have came up. So we promise you this, we will answer all those questions, and we will get all those questions sent out to everyone that was on tonight. So that's a promise from us at Benco, and I'm sure Lori will do it with us. So I want to say thank you very much to Lori and Paul. Amazing job. Wendy and Chris, thank you so much for jumping in tonight and helping us, because we had a lot of people on. So I really appreciate your time tonight. I want to tell you a little bit now about what's coming up. So please make sure that you scan this QR code. It'll take you to the website. It'll tell you what's coming up on our new webinars. Oh, and I'm sorry, go back one. I apologize. I didn't know. This is also a radiology test. It's going to actually be done, of course, it's going to be done in person and also virtual. So a lot of us need that. I know I need that for my license. A lot of us need this course to renew our license. So this is a workshop, not a webinar. So please make sure that you do the scan the CR code, and that way you can get registered for this workshop. The upcoming workshop is going to be 2 hours. It's $49 a person. And all you need to do is go to shop.benco.com and enter that item number, which is 5952-230. And we'll get you all signed up. And one of the upcoming webinars that is going to be, it's already filling up very quickly, is going to be, all of our new ADA codes, what's new, what's changed, and these are going to be all dental codes. So please make sure, the new guidelines came out for 2022. We want to make sure that you're upgraded, to make sure that you're getting everything paid for and also paid for correctly. So there's nobody better person to bring on than Roy Shelburne. Dr. Shelburne's going to be going over all the new codes. And again, it's going to be sponsored by Care Credit. And that's going to be January 26th. So if you have any questions about tonight, because there was a lot of things going on, you can always email us at practicecoaching@benco.com. Again, that's practicecoaching@benco.com, and we'll be more than happy to answer any of your questions. Panelists, thank you so much. Y'all did an amazing job. Paul, I know you and Lori worked really hard on this. Wendy and Chris, thanks for jumping on, and we will see you later. Have a good evening. Bye-bye, everybody.
Bye-bye.
Bye.
Bye.